Have you ever woken up in the morning with your mouth so dry that your tongue feels stuck, your lips feel tight, and swallowing is uncomfortable until you reach for a glass of water? For many people, especially after the age of 60, this becomes such a familiar part of the morning that they stop paying attention to it. They keep water beside the bed, take a few sips when they wake up, and tell themselves that dry mouth is simply one more thing that comes with getting older, but persistent dry mouth should not be brushed aside so easily. An occasional dry mouth can happen to anyone. You may have slept in a warm room, breathed through your mouth during the night, eaten something salty, had a little too much alcohol, or simply not had enough fluids during the day. But when the same thing happens morning after morning, your body may be trying to tell you something. Sometimes the reason is simple. You may be sleeping with your mouth open. You may have nasal congestion. The air in your room may be too dry. But in other cases, dry mouth may be connected to a medication, poor sleep, high blood sugar, or a health condition that has not yet been recognized. That does not mean every case of dry mouth is dangerous. It simply means that a symptom which keeps returning deserves an explanation. Most people think of saliva as nothing more than moisture in the mouth. In reality, saliva is one of the body's quietest and most important protective fluids. It helps you speak comfortably. It allows you to taste food. It softens what you chew and makes swallowing easier. It begins part of the digestive process before food ever reaches the stomach. It washes away food particles, helps control bacteria, protects the gums, neutralizes acids, and supports the surface of the teeth. You rarely notice any of this because saliva works in the background all day and all night. But when your body stops producing enough of it, several problems can begin at the same time. Food may become harder to chew. Swallowing may feel awkward. Your tongue may feel sore or coated. Your lips may crack. Your breath may change. Your gums may become irritated, and cavities may begin appearing faster than you would expect. In older adults, the effects can extend far beyond the mouth. Let me tell you about a woman I will call Susan. Susan was 71 years old and lived on her own. She was independent, careful with her health, and proud of the fact that she managed her meals, appointments, and medications without help. For more than a year, she had been waking up with an extremely dry mouth. At first, she blamed the heater in her bedroom. Then she thought she was probably not drinking enough water. So she began keeping a large glass beside the bed and taking a few sips whenever she woke during the night. The water helped for a moment, but the relief never lasted. Within minutes, her mouth felt dry again because the discomfort usually improved after she got up and started moving around. Susan never thought it was important enough to mention. She assumed it was simply part of aging. Then her eating habits began to change. Toast felt too dry. Crackers were uncomfortable. Meat took more effort to chew and often seemed to stick in her mouth. She began taking a drink after nearly every bite. Little by little, she started avoiding foods she had eaten for years. She replaced meat and vegetables with soup, pudding, soft bread, and other foods that were easier to swallow. She was still eating 3 times a day, so she believed everything was fine. But a few months later, her daughter noticed that Susan's clothes were hanging more loosely. Susan had lost weight without trying. The problem was not that she had stopped eating. The problem was that both the amount and the quality of her food had quietly changed. Then, during a routine dental visit, several new areas of tooth decay were found. Susan was shocked. She brushed every day and had never had serious problems with her teeth. Eventually, a pharmacist sat down with her and reviewed everything she was taking. That included her prescriptions, her allergy tablets, a bladder control medicine, and an occasional sleep aid. Each one had been taken for a valid reason. But several of them could reduce saliva production, and their drying effects were adding together. After speaking with her doctor, Susan's medication plan was carefully reviewed. Nothing was stopped suddenly. Nothing was changed without supervision. But a few adjustments were made, and she also began using an alcohol-free dry mouth rinse, a moisturizing gel before bed, and a cool mist humidifier in her bedroom. The improvement was gradual. Within several weeks, she noticed that she could wake up and swallow without immediately reaching for water. Eating became easier. Her appetite improved. Her weight stopped falling. Susan's experience is not unusual. Medication is one of the most common causes of dry mouth in older adults. Many prescription and over-the-counter products can interfere with normal saliva production. These may include certain antihistamines, antidepressants, sleep aids, bladder control medicines, decongestants, pain medicines, muscle relaxants, and some treatments used for blood pressure or heart conditions. Diuretics, often called water pills, can also contribute to dryness in some people by increasing fluid loss. The situation becomes more complicated when several medications are taken together. A single medicine may cause only mild dryness, but when 2 or 3 products have the same effect, the dryness can become much more noticeable. Some medications have what healthcare professionals call anticholinergic effects. These medicines can interfere with the chemical signals that help the salivary glands produce moisture. The greater the combined effect, the more likely it is that dry mouth may become persistent. This does not mean those medicines are bad. It does not mean they should be stopped. Many of them are necessary and treat important conditions. The goal is not to blame the medication. The goal is to find out whether the treatment plan can be adjusted safely when dry mouth begins affecting sleep, eating, swallowing, or dental health. Never stop a prescription medication on your own. Some medicines can cause serious problems if they are discontinued suddenly. Instead, write down everything you take. Include prescriptions, over-the-counter medicines, vitamins, supplements, allergy products, sleep aids, pain relievers, and anything you use only occasionally. Bring that list to your doctor or pharmacist. Explain when the dry mouth happens, how long it has been going on, and whether it affects your sleep, appetite, swallowing, speech, or teeth. You can say, "I keep waking up with a very dry mouth. Could we review whether any of my medications, or the combination of them, might be reducing my saliva?" That simple question may completely change the conversation. Medication, however, is not the only possible cause. The time of day when the dryness is worst can give you an important clue. When dry mouth is severe in the morning but improves during the day, mouth breathing during sleep is often involved. This can happen because of nasal congestion, allergies, a blocked nasal passage, or simply sleeping with the mouth open. It can also happen in people with obstructive sleep apnea. Sleep apnea causes the airway to narrow or close repeatedly during the night. A person may snore loudly, gasp, choke, or briefly wake up without remembering it. Because breathing becomes difficult, the mouth may remain open for long periods, leaving the tissues dry by morning. Dry mouth alone does not mean that someone has sleep apnea, but when it appears together with loud snoring, morning headaches, poor concentration, daytime sleepiness, or waking up feeling exhausted despite spending enough time in bed, it is worth discussing with a healthcare professional. A sleep evaluation may be needed to determine whether breathing is being interrupted at night. Blood sugar is another possible factor. When blood glucose rises to high, the kidneys try to remove some of the excess sugar through the urine. This can lead to frequent urination, increased thirst, dehydration, and dryness of the mouth. Pay attention if dry mouth appears together with repeated nighttime urination, constant thirst, blurred vision, unusual fatigue, slow healing wounds, or an unexplained change in weight. These symptoms do not confirm diabetes, but they are good reasons to have your blood sugar checked. A healthcare professional may recommend a fasting blood glucose test or an A1C test. Dry mouth can also appear together with very dry, irritated eyes. Some people describe a burning or gritty feeling, as though there is sand beneath the eyelids. One possible cause is Sjogren's disease, an autoimmune condition in which the immune system affects the glands that produce tears and saliva. It is more common in women and is often recognized in middle age or later life. However, dry eyes and dry mouth can also be caused by medications, environmental conditions, and other health problems. The important point is that persistent dryness affecting both the mouth and the eyes should not simply be blamed on age. It deserves proper evaluation. Other possible causes of dry mouth include dehydration, nerve damage, hormonal changes, tobacco use, frequent alcohol consumption, certain infections, radiation treatment involving the head or neck, and some kidney or neurological conditions. Anxiety can also play a role. When people are under stress, they may breathe more rapidly, sleep poorly, or breathe through the mouth. Saliva production may also temporarily decrease because there are so many possible causes. It is not wise to diagnose yourself based on dry mouth alone. The pattern matters. The symptoms that appear with it matter. Your medications, medical history, sleep quality, and oral health all matter. Many people respond to dry mouth by drinking more water. Drinking enough fluid is important, and dehydration can certainly make dryness worse, but water cannot do everything saliva does. Saliva is mostly water, but it also contains enzymes, minerals, proteins, and protective substances that coat the tissues of the mouth. Water passes through quickly. It may relieve discomfort for a short time, but it cannot replace that protective layer. This is why someone can drink water throughout the day and still feel dry again only a few minutes later. For people with heart failure, kidney disease, or another condition that requires fluid restriction, it is especially important not to increase water intake without medical advice. One of the most overlooked effects of dry mouth is what it can do to nutrition. When saliva is reduced, food becomes harder to chew and swallow. Bread, crackers, rice, meat, raw vegetables, nuts, and other dry foods may become uncomfortable. Some people begin avoiding these foods without realizing how much their diet is changing. They may replace protein-rich meals and fresh foods with softer choices that are easier to swallow but lower in nutritional value. Over time, this can lead to unintended weight loss, weakness, and loss of muscle. In older adults, muscle loss can affect balance, walking speed, recovery from illness, and the ability to remain independent. What begins as a small problem in the mouth can slowly affect the entire body. Watch for signs such as looser clothing, a reduced appetite, taking longer to finish meals, needing water with every bite, avoiding meals with other people, or becoming tired while eating. Coughing, choking, or feeling that food is stuck should never be ignored. Those symptoms may point to a swallowing problem that needs professional assessment. Saliva also plays an important role in controlling bacteria inside the mouth. A healthy mouth naturally contains many different microorganisms. Most are harmless when the environment stays balanced. Saliva helps maintain that balance by washing away food debris, reducing acidity, and preventing harmful bacteria and yeast from growing too quickly. When the mouth remains dry, plaque can build up more easily. The gums may become red, swollen, or prone to bleeding. Bad breath may become persistent. The tongue may feel sore or appear coated. Some people develop oral thrush, a yeast infection that may cause white patches, redness, burning, soreness, or a cotton-like feeling in the mouth. White or red patches that do not go away, sores that fail to heal, unexplained bleeding, or persistent pain should be examined by a doctor or dentist. The teeth can also deteriorate quickly when saliva is reduced. Saliva helps neutralize acids produced by bacteria after eating. It also carries minerals that support the surface of the teeth. Without that protection, cavities can develop around the gum line, between the teeth, or unexposed roots. This can happen even in someone who brushes regularly. Dental visits become especially important when dry mouth is persistent because a dentist may notice changes before you feel pain. People who wear dentures are not protected from the effects of dry mouth. Saliva normally helps reduce friction between dentures and the tissue underneath. When the mouth is dry, dentures may rub, slip, or create painful areas. Bacteria and yeast can also collect beneath the appliance. Dentures should be cleaned every day, and the gums, tongue, and remaining teeth should be cleaned gently as well. Many people benefit from removing dentures at night unless their dentist has advised otherwise. So what should you do if you repeatedly wake up with a dry mouth? Start by paying attention to the pattern. Tomorrow morning, before you drink water or brush your teeth, pause for a moment. Notice whether there is any saliva in your mouth. Does it feel thin and watery or thick and sticky? Can you swallow comfortably? Does your tongue feel coated? Are your lips cracked? Is there an unusual taste? Does your breath smell different? Think about how you slept. Did you wake with your mouth open? Has anyone told you that you snore or gasp during the night? Did you wake several times to urinate? Do your eyes feel dry or gritty? Do you have a morning headache? Do you feel exhausted even after a full night in bed? Pay attention to these details for several mornings and write them down. A short record of your symptoms can be far more useful than simply telling your doctor, "My mouth feels dry sometimes." The next step is to review your medications with a doctor or a pharmacist. Do not forget products you use only occasionally. Allergy tablets, cold medicines, sleep aids, bladder control medicines, and pain relievers are often left off medication lists even though they may contribute significantly. There are also simple ways to make the mouth more comfortable and protect it from damage. Sip water regularly if you are not under a fluid restriction. Small amounts throughout the day may be more comfortable than drinking a large amount all at once. Sugar-free chewing gum can help stimulate saliva when the glands are still able to respond. Sugar-free lozenges may also help. Products containing xylitol may support dental health. Although too much can cause digestive discomfort, xylitol is also extremely dangerous to dogs, so any product containing it should always be stored safely. Avoid sucking on sugary sweets throughout the day when saliva is low. Frequent sugar exposure can sharply increase the risk of tooth decay. Choose an alcohol-free mouth rinse. Many traditional mouthwashes contain alcohol or strong flavoring agents that can make dry tissues burn and feel even more uncomfortable. Dry mouth sprays, rinses, and moisturizing gels are available without a prescription in many pharmacies. A gel used before bed may last longer than water alone. Brush gently with fluoride toothpaste at least twice a day, depending on your dental health. Your dentist may recommend additional fluoride protection. Try to manage nasal congestion so that breathing through the nose is easier. Avoid using medicated nasal sprays longer than directed because some can make congestion worse when overused. A cool mist humidifier may help if the bedroom air is dry. Just remember to clean it regularly because standing water can allow bacteria or mold to grow. Tobacco and alcohol can irritate the tissues of the mouth and make dryness worse. Caffeine may also worsen symptoms in some people. So notice whether coffee or strong tea affects you. When preparing meals, add moisture whenever possible. Broth, sauces, yogurt, olive oil, or soft vegetables may make food easier to eat. Depending on your dietary needs, choose cooking methods that keep meat tender. Cut food into smaller pieces and take your time chewing. The goal is to keep nutritious foods in your diet rather than replacing everything with soft foods that offer very little nourishment. Some situations require more urgent attention. Seek emergency care if dry mouth occurs together with severe difficulty breathing, swelling of the tongue or lips, fainting, sudden confusion, chest pain, a very fast or irregular heartbeat, or sudden weakness on one side of the body. Contact a healthcare professional promptly if you cannot swallow fluids, show signs of severe dehydration, develop persistent mouth sores, notice white patches that do not clear, experience significant unexplained weight loss, or repeatedly cough and choke while eating. Dry mouth accompanied by frequent respiratory infections should also be evaluated, especially if swallowing problems are present. For many people, the cause of dry mouth is manageable. It may be related to medication, mouth breathing, dry indoor air, a dental problem, or another treatable condition. The most important thing is not to assume that nothing can be done. Growing older does not mean every uncomfortable symptom should simply be accepted. A symptom that keeps returning still deserves attention, especially when it affects sleep, eating, speaking, or dental health. Tomorrow morning, before you automatically reach for the glass beside your bed, take a few seconds to notice what your mouth feels like. Pay attention to the pattern. Write down what you observe. Review your medications with a qualified professional. And never make changes on your own. A dry mouth is not always a sign of serious illness. But when it returns day after day, it is worth understanding why. Taking it seriously does not mean expecting the worst. It means listening early, protecting your health, and giving yourself the best chance to deal with the cause before a small problem becomes a larger one.